nieces and nephews, Uncle JD here again. I'm gonna try to stay live as long as possible. Got some dip in my lip there. Anyway, getting ready for some anesthesia. So they're gonna do the procedure. You're gonna put me under. Yo, Gray, what's going on, man? So they're gonna put me under anesthesia for this procedure that I'm getting ready for. So I'm probably gonna be really loopy as shit. No telling when I'll be coming back to my senses after the anesthesia. So yeah. If I have to get off here right away, I'm just gonna end it. If I can just mute it and set the phone down, I will. I'm gonna try to stay live as long as I can. It was kind of a back and forth on what their plans were, but they're getting ready to get it going, and it is under anesthesia, so I will be completely out. I won't be feeling anything, and hopefully I'll be able to eat after coming out of it. But we'll see what happens. I mean, damn it. Right now is usually whenever they take the dinner order. I'm not going to be able to put it in. When are you getting the anesthesia? Okay, so they're doing some paperwork right now in regards to the anesthesia. There's going to be a few people that are going to be coming in and out, talking to me and getting things ready. But I do well with anesthesia. I like seeing the twilight whenever I'm going under or coming out of it. The only thing I don't like is whenever I'm coming out of anesthesia and I'm feeling pain. Because for some reason I have a tendency of coming out of anesthesia a little bit quicker than others. Wow, the room just jumped up to 15 viewers. Hello everybody, Uncle JD here, getting ready to go under anesthesia for a procedure involving an enlarged artery. And just like that, it dropped down to 8. Anyway, say hello and what country you're from. Oh wait, hang on. Alright, so it was just having to answer a couple of questions. Sebastian says Sigmund Nabin E. Chatten. I believe that's German, but hello, Sebastian. Someone did come in, Gray. You are correct there. Gotcha creator underscore Roblox creator says, I hope you'll be okay. I will be. Basically what it is they're gonna go in and they're gonna numb out the nerves in my abdomen to where the pain from my pancreas, my hold on a second. It's going to numb out the pain from my pancreatitis, my enlarged liver, and I also have a enlarged artery. Those three things are basically what's causing the pain that I'm experiencing. So they're going to go in and numb it out. They refer to it as blockers or something like that to block the pain out. Yeah, anesthesia I do good with. Hopefully they, don't make any mistakes themselves. And then coming out of anesthesia I'm good with. Gray Miller says, are gonna end the live when you get the anesthesia. Okay, so if I can keep it live all the way up to the point of anesthesia, then I will. If it turns into a situation where I have to cut it to where I can't just, mute it and set the phone down, depending on the situation will determine if I have to end it abruptly or all of a sudden, or if I can keep it going until the point of anesthesia. But I'm going to try to stay live as long as I can up to the point of anesthesia, or up until the point that they take my walking stick and phones and set them to the side. I'm not really sure what's happening just yet. There may be points where I'll have to mute the audio because, if they can be heard out there discussing people's, information, I can't allow that. So I will mute when I have to. Will cut off if I have to. But like I said, I'm going to try to stay on up until the point of up to as close to the point of anesthesia as possible. Just kind of give y'all a different view. That's a window, not a picture. That curtain section is considered a restroom in this room. And there's a comfortable chair there, but hey, at least it seems like they're going to get it over with. Thank you, Gray Miller, for the wishes of good luck. I appreciate that. In the meantime, for anyone in the live here, say hello and what country you're from so I can say hello back and give your country a shout out. Yeah, I know. We got some palm trees out there and you can see the sky a bit. It's a nice location for that window, Gray. So yeah, I'll be probably repeating these announcements quite a bit until we actually, kick it off. But me and Gray Miller, hi, from St. George, Utah. Okay, so Gray Miller, a dedicated viewer of mine. Appreciate you, by the way, Gray. Giving a shout out to St. George, Utah. Big ups to St. George, Utah. But yeah, so my friend Sick Thought, at Sick Thought 813, he's also on YouTube. Go check him out. Me and him are in the works of trying to upgrade some equipment Sick Thought and Jess. That's my favorite niece and nephews right there. Um, they back me up. Wait, niece and nephew. Yeah, because just the two of them. Um, Basically, they have been behind me since the first day we met at the Wawa gas station in Town and Country, and they've helped me out so much. They've hooked me up with so many things to help me get through this whole being homeless thing. Um, but he's also been a huge encouragement to it. All right, Gray Miller's got to go. Talk to you next time, Gray. Thanks for the wishes for the procedure. Um, but yeah, so me and Sick Dot and Jess and all that, we're in the works of upgrading to getting some kind of laptop to where I can work with that. Me and Sick Dot are also going to be revamping our music projects that we've got lined up. But the plan is to start doing a live talk show, uh, a live call-in talk show. At least on Thursday evenings. I'm going to try to do a daytime call-in talk show for those on the other side of the globe. That way they have an opportunity to call into the show if they would like. But it's going to be cool. There's going to be like an hour of different segments, and then an hour of call-in time. There will be themes to the shows and the call-in sessions. It could be like an anger management thing. It could be a get your mind right session. There's a number of things it could be. But and then there will be the occasional 3-hour special. To where you get the hour of content, you get the hour of call-in, and then that third hour would also be call-in, but depending on what the situation is. So basically, Uncle JD's got a lot of plans for the live streams. There will also be random unscheduled lives that I do. Because I like the live atmosphere better than doing pre-recorded videos. Because it's like with the live streams, there's a chat there. I can interact with people instead of just putting content out there and hoping someone will leave a comment. This way I can actually communicate back and forth with the individual that's watching, which I like that better. And TikTok. You gotta have 1,000 followers and something else or whatever in order to go live on TikTok. So, if you're on TikTok, go to TikTok, follow Uncle JD. My ad is at uncle.j.d.333. Follow me on there. That way I can start doing lives for the TikTok folks also. But YouTube is where I got my start, and YouTube is where I will, if I give up on any platforms, YouTube will be the last one. Again, for the people that are watching the archive video of this, Zari asks, am I cancer? No. No cancer. It's really, the procedure's nothing really major. The procedure is going to be going in and numbing out the nerves in my abdomen because I have pancreatitis. enlarged liver and an enlarged artery, all in that area that are causing a lot of pain. So they're going to go in and basically numb out or block out the pain from the nerve receptors or something like that in my abdomen to where I don't feel, the pain as much. Right now they're filling out paperwork and getting everything set up for me to receive anesthesia. I like anesthesia. I do. I just hope the procedure doesn't leave any pain or anything like that afterwards. And hopefully I can eat right after. Hang on a second, y'all. See if I can get a clear shot of that palm tree out there. Yeah, that palm tree is nice looking. It's kind of giving me some peace. Juan Gonzalez, Joe, remember me? Yep, I do. How's it going? Juan Gonzalez says good to hear. Yeah, so just getting ready for a procedure. Hopefully to numb out some pain in the abdomen. Gonna be anesthetized. Anesthesia is always nice. For those of you just joining, I am getting ready to be given some anesthesia later, or here in a little while, to have a procedure done. If I'm not mistaken, they're going to be sticking needles like that long. About the length of my head, probably. Through my back, going into my abdomen. Unfortunately, they're going to put me out for it. I'm going to try to stay live as long as possible leading up to the anesthetic part. But all I know is ran out of dip. I really don't like nicotine patches, so I rejected the nicotine patch. And hopefully I can get out of here tomorrow. Probably Wednesday at the latest, hopefully. No later than Wednesday. Really want to smoke a cigarette. But it is what it is. Again, going to be doing a live call-in talk show on Thursday evenings, typically 2 hours long. The first hour will be different segments of content, and then the second hour will be the call-in portion of the show. Um, and there will be the occasional 3-hour shows where it's the hour of content and then you get 2 hours of call-in time. Supposed to be getting some equipment upgrades. Instead of having to use this cell phone, I'll be able to use. We're working on getting a laptop, and when I say we, I mean me, Sick Thought, and Jess. The Triforce of Uncle JD Productions. Anyway, that was a Zelda reference. Zelda 2, The Adventures of Link, was probably the best Zelda game, though. But that's besides the point. We're working on getting a laptop. Hey, there he is. Sick Dot, whoop whoop. He's in the room. Basically working on, improving the quality of the Uncle JD show. And all things Uncle JD as well. But make sure to go check out Sick Dot's YouTube channel and all that. Check out his rhymes and stuff. Dude, I'm out of dip, man. Hey, just saying. I've got $9.90 in my pocket. Give me a call later. Maybe we could possibly work something out. Just let me know. That guy you found on your feed. Hey, you're back. Welcome back there. Cool. Yeah, because they're getting ready to put me under anesthesia sometime soon in the procedure, so I'm not done. I'm not sure when it'll be done. Actually, hang on. All right, so yes, they were explaining the procedure. Yes, I did wrestle an alligator for a can of dip once. It was right outside of Sick Thought's apartment. Sick Thought, not sure what you mean by doo-doo, 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 doo-doo. Unless that's like the Jaws music. Is that what that's supposed to be? I could be wrong. Blue says hi. No, not yet. No, I'm kidding. I'm kidding. Hello back to Blue. I did see what you said there. That guy you found on your feed about getting there. I'm not really sure what those emojis from both that guy you found on your feed and Sick Thought. I'm not sure what those faces mean, but that's probably what I'll be picturing as I'm going under anesthesia. Blue says, how are you? Could be better, but I'm all right. Oh, that type of thing. Gotcha. But yeah, getting ready for a procedure, getting ready to go under anesthesia. Angel A, my prayers and thoughts are with you. Thank you for that. But yeah, I do go with anesthesia usually. This is just I've had my arm cut wide open and pieced together with a piece of cadaver bone and a metal plate and a bunch of screws, and I've had my stomach cut open twice due to cysts on the pancreas and infected gallbladders and stuff like that, But this one is going to be a little bit different. I believe this is where they're sticking needles in, unless there's some kind of endoscopic way of doing it. But I'll be out, so it's all good. No, I probably will be dropping F-bombs inside my head while I'm under. So just rest assured, I haven't forgotten how to say the word. Let's see here. How long am I going to be out? No clue. It's a fairly quick procedure. But I don't know, like, the anesthesia part. Hang on a second. Okay, false alarm on that. Let's see here. 219. I'll tell you what, once I can ask, I'll ask, and I will shoot you a text. No. Let me see if I can find out. Hang on. So, Sick Thought. Sick Thought, you still in here, bro? Blue, you're gonna go have a shower. All right, enjoy that. Angel A. I twist my hair like you do. Been doing it all my life. So 8. All right. So they're saying that I should be back in my room. Estimated guess is 4:30. But so I'm just gonna go with sometime after 4:30. What I would suggest doing, just shoot me a text whenever you're thinking you'd be able to head over after 4:30. If I don't answer, that means I'm not done yet. If I do answer, then that means I'm good to go. But that's the best idea that I could come up with. Oh, I'm sorry, they use that finger a lot. Sorry? Yeah.
TikTok?
YouTube.
Oh.
Yeah. I mean, I haven't gotten to the point of doing TikTok live yet. Gotta have 1,000 followers.
Oh, I didn't know that. Little poker. I did not know that.
Yeah, so far I think I'm sitting at 298 subscribers at the moment on YouTube, and I've only been doing this for like maybe 8 months.
Oh, nice. Oh, sweet. All good. Just keep that for a little while.
Sure. What did it read at?
High, but it's lower than it was before. 265.
Right. Okay, bro. Sick Thought says, okay, bro, try not to dream about. Oh, there's no such thing as too much when it comes to body rotten. Anyway. Love you guys too. That goes for you, Sick Thought, Jess, and the girls, all everybody over there. Little fun fact about Bonnie Rotten. Back when I used to work at Fantasyland over in Drew Park, those are the adult theaters and things. I was just a cashier. I sold tickets, magazines, DVDs, toys, that sort of thing. I didn't perform. But yeah, I had the opportunity of meeting Bonnie Rotten at the porn star convention that they had in Tampa. But somebody called in, and I had to go in and work. And you know what they ended up calling in for? They called in so they could have gone to the convention. That pisses me off, because I would have gotten paid to go to the convention, gotten photos with Bonnie Rotten and many others, and I would have been able to have gotten out and about and had fun. But this person called in, so I had to cover their shift at the job, and they went to the convention. Well, ain't life a bitch? Because somehow, not by me, but some word got around to management, and they found out that the person called into that, and they got fired. Hang on. Oh, okay. Now, there's been a lot of crazy things that's happened at those stores. Now, I can't say who did what and when and how and where, but I could tell you the type of activity. But that would be all hypothetical and hearsay. But we'll save that for one of the juicy live streams. Uncle JD's Tales of Fantasyland. Right. Short, simple, straight to the point. Like there was this, no, I'm not going to discuss it right now, but let's just say we did have a male XXX actor come into the store during the overnight hours, and he brought some people with him. And that place was jumping that night. But I'll save that for the juicy one. You know what? I've come to a realization and a solution to a situation. Instead of, man, you ain't kidding, sick thought, they do get pretty damn wild. But anyway, where was I going? Juicy one. Oh yeah, okay. So to make it easier on the viewers, I'm gonna make it a note to post an announcement for the live stream that is coming up. If it is a themed live stream, like specifically about a certain topic, or if it's going to be one of those, you know, potluck style live streams where I'll bring this and that to the table, y'all bring this and that to the table, and then we go from there. Yo, sick. There's been like 3 or 4 nurses that have passed by my room that have been looking into the doorway after the one guy asked if I was doing a live right now, and then after telling him that I'm doing YouTube live. Yo, 1 second.
Did the anesthesiologist come talk to you?
Yes.
Okay.
I'm sorry, I had to show the booty. I had to. Had to show the booty. Alright, so sick. When it comes to anesthesia, for me, it basically, I see everything that I see, but then my eyes just close and I fade. And if you recall the sampler for ICP's The Wraith Shangri-La album, how it had that kaleidoscope look on the cover, on the CD itself. You can always Google it if you don't know what I'm talking about to see the image of it. But it's the ICP The Wraith Shangri-La sampler disc.
Yeah,
That color, or that kaleidoscope look, I start seeing live kaleidoscope vision. And then whenever I come out of it, it's basically the reverse of that. That's what I've experienced. 1 second.
Do you have any oxygen props?
Any what?
I don't see any. It's the one in your finger.
Oh.
I guess we took it away at some point.
Oh, that's the clamping thing?
Yep.
Yeah, they just kept it.
Next, we're gonna see the actual doctor who's gonna do this.
Okay.
Sample. And the anesthesia guy wanted us to get 4 units of insulin before we go there.
Okay.
All right. Abby's gonna handle that. Hold on a second. Closer to the
Okay.
And now, this is for the anesthesia guy with signature right here.
Okay. Yes, sir.
Yep, right there.
That.
Doesn't have to be perfect.
Damn it. I'm so sorry about
It's
that.
okay. Way better than mine.
That thing kind of hindering me there.
Okay, my turn. That's mine.
Short and simple, though.
Yeah.
Simple? Simple. Short and simple. Yeah, I don't know if I've been given something already or not if I'm talking like that. Alright, so I'm only going to mute it if I have to. I'm only going to cut out of the live if I have to. But I'm going to keep this thing up and running as much as I can. But I cannot show certain things, so keep that in mind. I don't even know if I'm supposed to be doing this, but I'm doing it anyway until I get caught or told I have to stop. Now, yes, when you're out in public, you can, record people. Florida is one of those states where you don't need consent. You don't need consent in public, but this is technically not public. This is technically a private domain within a public building. So, therefore, I can't just record anybody that I want to. And also, can't just record any audio that I want to because, if it's exposing somebody's information, that goes against HIPAA laws and all that stuff. But, so yeah, this is still hospital week on Uncle JD's YouTube channel. Now I'm assuming that they'll have already taken everything away from me by the time that they actually go through to put me under the anesthesia. But I'm going to record as long as I can up to that point. They had me take off my pants. Which is fine. That's not what I'm getting at. They had me take off my pants. Preparing for the procedure. They canceled the procedure. I put my pants back on. Well, then they rescheduled the procedure. My pants are still on. I hope they don't have a problem with that. But here's the thing. They should only have to pull my pants down so far for what it is that they're doing. So I cleaned like I was told to. I did not rinse like I was told to. Because it was that perennial clean shit that they have you use. Alright, so for those of you that are in the room, I'm getting ready to go under anesthesia. How many of you have gone under anesthesia? And what was your experiences like? Andrew asks, why am I in the hospital? Alright, so I was having some abdominal pain. And I thought it was just from my pancreatitis and enlarged liver. But I was in here on this past Friday. Not past Friday, but the one before that. I was in here then. They sent me home the Sunday after. Felt okay Sunday. Felt no pain Monday. No, sorry. Scratch that. Oh, no. Yeah, I felt okay Monday, and then Tuesday, the pain came back. Well, they did a CAT scan. They found that I have a enlarged artery, so that's something new. Sick thought, appreciate you. And again, just hit me up sometime after 4:30 p.m. And if I haven't heard from you, I'll hit you up. Anyway, so basically the combination of all those things, Andrew, pancreatitis, enlarged liver, enlarged artery was causing me some abdominal pain. So what they're going to do is they're going to put me under, go in, and they're going to numb out the nerves in the abdomen area. This way I don't have to deal with the pain as much. Adam, hi, English or Spanish? Sick thought. Okay, bro. Adam would have to go with English. I only know certain phrases in Spanish. I mean, you can say something, I'll try to read it. I'll tell you if I comprehend it, but if you really want to get somewhere with communication, we'd probably need to stick to English. My throat is really dry right now. Oh, before I forget, today is Charles Manson's birthday. Happy birthday, Charlie. And before any of you freak out for me wishing Charles Manson a happy birthday, y'all really need to go back and do some research and reevaluate it. Because Charles Manson was used as a scapegoat. Somebody had to take a fall, and it was Charles. Justice for Charles Manson. He was not guilty. He did not tell them to kill anyone. He never killed anyone. But I'm not going to get on that soapbox right now. But anyway, happy birthday, Charlie. Alright, so I usually don't bitch and complain, but I'm going to right now. I've decided not to keep my mouth shut about it. So, had a nurse by the name of Ava last night, had a tech by the name of Angelica last night. Both of them kept telling me I couldn't have any coffee with sweet and low because my sugars were high. Sweet and low is not sugar. Common sense will tell you that sweet and low is okay. But they kept telling me no. And then whenever they got replaced, the staff after them were like, why would they say you can't have that? It's not sugar. So, yeah. No, sick thought. I hate the fake crap too, but I like having the fake crap than no crap. I don't take crap in my coffee, but I would rather have the fake sweetener than no sweetener. You eat pieces of shit for breakfast? No. Yeah. But yeah, the point is they kept telling me I couldn't have this and I couldn't have that as if they were already, yes, good call, sick thought. But they were already telling me no, I couldn't have something as if they were already committed to saying that I couldn't have it. I barely got a sugar-free ginger ale. But I don't want to cause any problems in here. Because there's hospitals that'll keep you in here longer than you need to be just for the inconvenience and the fact that it raises up a higher hospital bill if you piss them off. I'm not saying that's the way this place is, but there's a lot of them that are like that. Well, it's been a few moments since a good close-up has happened, so here you go. That is correct, Sick Thought. Nothing except for sips of water to take my medicine with since right about 7:30 last night, when I was allowed to eat up until midnight.
Hello.
All right, hang
Hello.
on.
How are you?
Pretty well. Yourself?
Okay. For the radiologist. Another doctor. Here we go again, huh? A different doctor this time, huh? But one that does these kind of help you out kind of techniques, okay? So that's the thing, you know. If you're having some discomfort there, this test may do the trick there, you know.
Gotcha.
Celiac. Hello. How are you? So, it may not. Okay. So don't think this is you know, the miracle cure, that's for sure. There's no miracle cures, but what happens is if they're having discomfort and kind of continually have discomfort in that midline epigastric region, then maybe using this medicine may help stop that pain. You know?
Okay.
And what happens is over time, the pancreas, you know, not liking being irritated, causes all sorts of pain on the nerves there. You know?
Right.
So, and unfortunately, that causes the whip feeling. Give you a sense of what's going on.
Okay.
You know what you have, right? You got a bunch of stuff going on, right? They told you what you have. Pancreatitis, all sorts of bad things like that, right? Splenic venous thrombose, you got all sorts of things going on. So these can't be good. So now we're going to try to help you out with all that stuff, you know?
Gotcha.
You have a primary care doctor who's following you for all these things?
Not at the moment.
Okay, you got to need one, okay, bud?
Okay.
I'm just telling you. Not as a doctor, but as a person, you're going to need a doctor. You know? This is a lot of problems here, okay? For a young guy, you're only how old?
43.
43, you're a young guy, okay? I just read what I read, okay? So what happens is, here's you on screen here. Don't need to know much about radiology, but liver is this organ here, spleen is this organ here. See, the vessel goes to the liver nicely, but it's locked up, okay? The splenic vein is totally gone, okay? And that's from pancreatitis, and that's from, you can see calcification, see pancreas has been dinged, and then the splenic vein is thrombosed. So what happens, that causes all the little pain fibers that are right here, keep causing you to have that mid-abdominal pain. What to do is place some medication right in that aorta, right around here, little pain centers, little plexus, as you can call them, that nerve that feed the bowels and feed your abdomen. That's why you're feeling that.
Mm.
So they've asked us to put a little medicine there, like a denatured alcohol, like a rubbing alcohol, same product. And that you can place right in this area here. The little guy right there is one of the nerve, maybe right in there is the other one. You can place them in there. Doing the direct, drawing and showing at the same time.
Right.
Place it right in that nerve center and put the medicine in there. And that alcohol will kind of irritate the nerves so they don't function anymore. Okay, and they won't cause any more discomfort. And that kind of causes no more pain to elicit around that area. That's the goal. Okay, kind of understand how that works. Sort of.
I'm following you.
Yeah, perfect. And if we can get the medicine in there, then it could take out these little nerve complexes, kind of ablate them or stop them from functioning. And you won't get the nerve impulses that cause you to keep having pain there. Does that sound reasonable? So it's called a nerve block. So we're going to block the nerve. Okay, right there, nerve block. And we can do both sides because there's a nerve on either side. Okay, and This is the celiac trunk, the main vessel that comes to your goes to your liver and your spleen, main artery. And right in there is where these nerves sit. It's called the celiac block. That's what it's called. So that's what we'll test. Only a few people do these things. I'm one of them. So I'm going to direct a small needle through your back. This is your back. This is your spine here. Okay. Here's your kidneys. Into these areas, one on each side. I'm going to try. I'm going to drive by. That's the straightest. You can see that's a pretty straight shot there. That one ain't so straight. So we're going to figure that out a little bit. Got to miss the. You're going to miss those. Kidneys. The spine's right there. Blocking the right. So you can see our space is limited to get in there.
Right.
Yeah, so we're going to use the CAT scan again. So you're back in the CAT scanner again. Yeah, that's this device here. And then we'll put you on your belly, and the anesthesia saw you, I guess, and we'll get you nice and prepped and going. All right, so we can put you there. And then we're going to pass our small needle. It's very tiny, tinier than that pen tip. Okay, don't need much. Get in there and try to hit those nerves. So far, so good.
Okay, and just to confirm, I'm being put under for this, right?
Yeah, the anesthesia people.
Okay.
Oh yeah, I'm not them. You talk to them.
Right.
Or
Yeah,
I'm not
no,
them.
I
just do the procedure.
no, I get that. I just want to make sure I'm out for that.
All right. So far, so good. Okay. So that's the benefit is that we can get this in there. Hopefully, we can get this in there, but it depends on how we can steer everything in there. Okay. We'll do it the safest way, obviously, possible. All right. What are the risks? Well, you can see there's a bunch of risks there, right? Okay. It's right off the bat. Vessels, kidneys, other sort of organs there. We're going to steer. We use that CAT scan guide that's right in. Infection, obviously small. We just wash it down a little bit here and here with some soap, basically. Sterile technique. Bleeding at the site, obviously nothing. We're done before we're done. We're done.
I'm just gonna do it through the IV for you.
Okay.
All right.
You can rest your arm, sorry. Relax it.
Have you procedure like this done before?
Not like this.
Okay.
Just I've had my arm repaired with a metal plate and a bunch of screws,
Okay, but nothing in this spot.
and then I've had my stomach cut open from here to here to get my gallbladder out and to drain a cyst on my pancreas.
Okay.
Yeah, but that's about it. This is something totally new for me.
Yeah. That's why I make sure we talk to you. When you go to sign the paperwork, it's exactly what you got all the you're gonna answer I'll answer all your questions and make sure you're absolutely certain, and then that's when we sign, okay?
Gotcha.
Questions for me about all this kind of stuff. Lots of absorb there. But you had your stomach opened up and your gallbladder taken out and a pancreatic cyst taken out. That's pretty impressive. You know, that's 100 times more than what we're doing here. I can tell you that. You know, I'm not cutting anybody. That's for sure. You had your cyst of a pancreas taken out. That's a
Well, it was.
stuff.
Well, what they did was they cut the front of the stomach, the back of the stomach, and then into the cyst, and then it drained into the stomach,
Yeah.
and they had a hose that they ran down, pumping all the stuff out, and it was a very miserable
Yeah, imagine
experience.
that. It's called the marsupial procedure. We do it. We know about it. Yeah. So this is far less than that, unfortunately.
Just so you know, he did just get 4 units of insulin because his blood sugar was 260.
Okay, sure. All right, Don, anything else we may have an answer for you about all this kind of stuff?
The one that is not such a straight shot.
Yeah.
If just to make sure I'm understanding correctly.
Yeah, that
if
one's
you're not able,
tougher, straight, that's not as straight. So we'll position you. Hopefully we can get to. This is just a picture
So-
of our CT scan.
so if you can't get to it, then it's not that you're gonna. If you can't get to it safely,
Right.
you're not gonna try and find an alternative.
No, we just go this. I would do the unilateral. We'll get this one. Should take it out too to help you
Okay.
out. Yeah.
Okay.
One over the two usually does great. If you get both, it's even wonderful. You know.
Right.
So because they all cross each other and feed the same nerve endings. So we can take that one out or that one out. we're good to go. You know,
Gotcha.
both be great. That's a win-win. You know.
And with that, if it's numbing out the, I guess, the pain receptors or whatever
Yeah,
in the
exactly
area,
what it is.
will I still experience pain from the pancreas, whereas I wouldn't feel it from somewhere else? Is
Right.
that what's happening?
Yeah, you'll take out the ones and the nerves that supposedly this is all theories that are feeding these pancreas, which have been irritated by the pancreatitis. You know, so that's
Okay.
the ones that should be taken out, so you won't feel anything from the pancreas.
Okay.
Other nerves obviously have nerves all along here that are going somewhere else.
Gotcha.
All right.
So I'll still be able to know if something's wrong, because it's like pain being that alert saying, hey, there's something wrong here. If I'm not feeling pain, my concern is like, okay, if something's happening, how am I going to know?
Well, that's the reason why this test is only done for cancer patients usually, and not for pancreatitis patients.
Gotcha.
So different kettle of fish here. So yeah, you just have to keep up with your doctors. You know, make sure you're you know, stay up with them. Any changes, they'll know by blood work or what have you. And if you have any discomfort, you shouldn't really have any. Hopefully, this is all treated. You know, that you're being treated for that.
Right.
And so we're going to take away the discomfort.
Okay.
All right. Looking good.
I
Questions?
do.
More questions about all this kind of stuff.
There may be down the road, but at the moment I can't think of anything.
Perfect. All right. Got a couple of forms to sign here.
Okay.
So you did the anesthesia people came in?
done.
Oh, perfect. All right, great. Not good. So now this stuff. So CT guided celiac. That's the celiac plexus block with anesthesia services. All right.
Confirm your date of birth for me, please.
It is January.
All right. So just sign and print your name. You're good to go.
Thanks, Dr.
Sure, no problem. Anytime we gotta, these are tests you don't see, they don't put this on the TV.
I never, you know what I'm saying? I haven't seen it.
Rare birds do these things. All right, boss. We will see you over there. We'll get you done. All
Thank
right. Okay. Anything comes up, let us know. We're around. So.
All right, will do. Thank you.
All right, bud.
All right, ready to go?
I guess I'm ready
Can
to.
be.
So now is the part where we're
We're gonna
doing
go to
the
the CT scanner.
Uh-huh.
We're gonna get you on the bed. It's a little uncomfortable, but bear with us. We'll do our timeout,
Mhm.
and anesthesia will begin their part, and then Dr. Stamble, the radiologist who just spoke to you, will do his part.
Gotcha. So basically, we're going into the anesthesia part.
We're going to the CT scanner, yes, and that's where the procedure is going to be, and that's where we do everything, anesthesia and the procedure. In the CT scan area, because we can't give anesthesia and then move you somewhere else, if that makes sense.
Yeah, no, it makes sense.
Isn't Ness over there? I want to ask her a question.
This thing going, hit y'all back later on. Pimp on wheels.
Five.